I was asked, what are the steps you can take for a sustainable practice when you're doing therapy or counseling with clients? I've seen several things over the years. One that I think is really important is to understand what you're good at. As a therapist, you may want to do everything. And I don't know that that's practical for a sustainable practice. If you want to have a practice that lasts for years and your ability to help people, you will need seriously to consider, what are you good at? What are the 2 or 3 topics that you feel particularly skilled in, that you feel educated about, and you start with that as a niche. Whenever I see a therapist who's in practice and they have a list of 100 different topics that they deal with, that generalized approach probably is less sustainable than, again, identifying what you're good at, what's your special niche. Another aspect, I think, of a sustainable practice is to make sure you can identify also what are your own wounds, what is your own history that you bring into the profession. I have seen many therapists and counselors all over the world, some who have been less successful because they're not working on their own personal issues. A good counselor has worked through their own stuff. They've worked on their own wounds. They have accountability for those. They have a place to go when they might be personally struggling. You don't want your own personal issues to come into the counseling setting. You don't want to bring countertransference into the client relationship. So the more work you can do on your own self, work through those things, the more proficient you'll be to have a sustainable practice. And the third step I would see in creating a good professional atmosphere would be your ongoing need for education, your ongoing need to collaborate with other professionals, to get feedback on your cases, to work together with others. Don't try and be an island. Don't do it on your own. Have others you can talk to, that you can consult on your cases, conferences and affiliations with different organizations where you can learn current trends in the research, current events, modern trends. This is all going to be very, very important. Sometimes I also get asked for pastoral care. When counseling is happening at a church or within a church system, pastoral care is being provided. At what point is it appropriate to refer someone out to licensed professional care? And there are really 2 main indicators I would think really give you a clue that perhaps the pastoral care needs to be referred also to licensed clinical work. The first red flag for me would be that the client doesn't seem to be making any progress. The same problem seems to be going on and on and on, and they may be very well attending church and doing well at church, but the problems they're struggling with just don't seem to be getting better. Sometimes that's because there are psychological underpinnings, or perhaps some emotional wounds or some trauma that's underneath those problems. And so unless you get with a licensed clinician who can sort of dig that out and help remove some of the layers to get to those issues, if you don't focus on some of those root clinical issues, the problem may never resolve. So knowing that things are not getting better is sometimes a very appropriate time to refer to licensed work. I think another very similar red flag when you might need to refer to a licensed clinician would be when the problem seems to get worse. So as a pastoral counselor, you're doing everything you can, you're doing everything you know how to help someone and feeding them spiritually. But for some reason, the problem seems to be escalating and things are getting worse and you're not sure why. A licensed clinician, again, should be able to peel off some of those layers to see what the root causes of some of that are. And again, if you don't get to some of the root issues, psychological issues, emotional issues, trauma issues, which usually would not be served in pastoral care, sometimes those problems will escalate and they will get worse. So another important consideration within pastoral care work and within the church would be how do you set things up in a way to avoid any kinds of spiritual abuse, manipulation, codependency in those relationships? How would you avoid that? How could you set things up to make sure things are as healthy as possible? And the answer, my response to that would be maybe interesting. I think within the church, generally speaking, we don't always do a good job of providing some form of feedback and accountability for those that work within the church culture. So pastoral care workers, pastors themselves, priests, and others who are working in leadership, pastoral care workers, even mental health professionals. There ought to be a system in place so that if I'm a pastoral care worker, I have someone I can go to for regular check-in, how I'm doing emotionally, and even with someone who maybe I have my own counselor, who knows my history. They know the wounds I've brought into my adult life. They know the issues I've worked on, the goals I've had, the emotional growth I've experienced. I need someone who sees all of me to be able to check things in. And there may be times I'm struggling again, or I maybe relapse with something I've struggled with before. If the church system doesn't have someone that I can check in with, or it feels perhaps culturally inappropriate to talk to someone because as a priest or a pastor or as a pastoral care worker, I have this need to be important or never have any problems or to be perfect in some way because I'm up at the pulpit every week, that's going to be a problem. Eventually, the isolation of that emotional scenario tends to cause old problems to come back. It creates a feeling of secrecy. So again, I think to avoid manipulation, abuse, codependency within the pastoral care and the church environment, leaders need a place to go for feedback, for accountability, a private, a confidential place to be able to sort through their own issues as they arise, because they are going to arise. The Savior doesn't simply just take away our problems. He expects us to push through our problems, to grow. I think God is more interested in our growth than He is in how much we can serve or how good of a leader we are. He wants us to be healthy. He wants us to be healthy leaders. And that involves acknowledging our weaknesses and struggling through our past and our wounds and learning how to grow in ways that's healthy, ongoing. Like you might take a shower every day, I believe it's important that leaders have a regular accountability path, a regular place to check in. Just like you need to shower every day, as a leader you need a place regularly where you can bathe in accountability and transparency and be a healthier leader.